I have this phrase that just says, hold on, pain ends, and it spells out hope because pain is never permanent. I'm Kreena. I was diagnosed with primary breast cancer in 2013. I'm born and raised in the UK. I was an accountant. I was doing really well in my career. I'd met my now husband. We got married when I was 30. And I guess, we were living the dream. And then in 2013, I noticed an inversion on my left breast in the shower one day. When I went to the doctor, her view at that point was that because I was 33 and I hadn't had children, that I had a blocked milk duct in my left breast. But by that point, I'd researched breast cancer. I sat in her chair and just said, I'm not going to leave your room until you refer me. And so I was referred over to a specialist breast clinic. The consultant got me on the bed and examined my breast and then said to me, I can actually feel 1, if not 2 lumps, which really confused me because, a week or so prior, my GP was telling me there was no lumps in that breast. In the 5 days that followed, I went through some intense testing. Those lumps, which couldn't be felt in the space of a few days, became huge and really apparent. I had a mastectomy on the breast that was holding the cancer, so that breast was removed. I had all of my lymph nodes removed, and then I went actually to see my oncologist. I had to change my plan to chemotherapy and radiotherapy combined. My active treatment, I guess, in terms of radiotherapy and chemotherapy was done in just about 6 or 7 months. There was a lot of surgery and a lot of sort of recovery to get through. And then we sort of arrived at the back end of 2015, having got through all of those operations. And we thought, 2016 is our year. We booked a holiday to Vancouver. I was feeling a bit off from the minute I landed, just coughing a lot and, just not quite myself. Those symptoms got worse and worse over the days to come, and I was trying to breathe but physically couldn't breathe. We got to the walk-in centre and I was one of the first to be seen, and the doctor there, he sent me to a local hospital that really struggled to diagnose me, and I was ambulanced over to Vancouver General.
Hi, I'm Margot Davis. I'm a clinical associate professor here at the University of British Columbia. I'm also a heart failure and transplant cardiologist, and I run the Cardio-Oncology clinic here at Vancouver General Hospital. Kreena presented to hospital with new shortness of breath. With her past medical history, certainly it became a strong suspicion that this could be chemotherapy related.
A cardiology team came down to my bedside. One held my hand and just sort of came down to me and he said, I know you can't talk. If you know that your chemotherapy was red in colour, squeeze my hand. And so I squeezed his hand so tightly because I knew it was a red liquid. They said, she's in acute heart failure. We need to get her to cardiac intensive care immediately. A doctor came up to me and explained that the chemotherapy I had had in 2013 had damaged my heart.
Over the last 10, 15 years, we've seen a real explosion of different cancer therapies that have different toxicities.
During my cancer treatment, we never had a conversation around the effects it could have on my heart and my heart health, and there was never a conversation around risk factors or symptoms that I should be aware of.
Many of these treatments do leave patients at risk throughout the rest of their lives. It's really important that their care providers be aware of the potential for late toxicity so that if anything ever does come up, it's not missed.
So I was kept in cardiac intensive care for just under 2 weeks, I think, and then transferred onto a cardiac ward. But I had to stay in Vancouver until they could get my heart function up to a place where I'd be fit to fly. Probably about 15 months after my own heart failure diagnosis, my mum went into heart failure herself. There's a good probability that we were both genetically predispositioned to heart failure.
It's really important that patients who are going to be receiving a potentially toxic therapy really be screened for any possible underlying heart disease or risk factors they might have. And that really just comes down to basics of medicine, right? The history, the physical exam.
If we get to a point where we're screening people before they start chemotherapy, it could change the way the treatment plan plays out.
We've come so far in cardio-oncology. We've got collaboration between the cardiologists and the oncologists. Patients in smaller communities where they don't have the resources, I think that's where there's still a bit of a disconnect. And that's where we need to continue to advance educational efforts towards oncologists and cardiologists who are caring for these patients.
I was very fortunate to be referred into my cardiologist now, Dr. Lyon, who I think is an incredible human being and, who rehabilitated me back to a place where my life is pretty much normal. We had definitely had conversations around parenthood and motherhood, and I'd received a message from Ina, who went on to become my very first surrogate. And in April 2018, she brought me, God, my life's biggest gift, my little baby girl Amala. Quite soon after having her, we thought we definitely want more children. I met Laura in sort of the September, October of 2019. In the August of 2020, 10 weeks prematurely, Laura went into spontaneous labor. She had an emergency C-section and delivered, my 3 beautiful baby boys. What a journey. I guess what ill health does for you is remind you to savor the small moments as well as the big. Walking my kids down to the car and getting them in their car seats, that's something I dreamed of once upon a time, and it's a dream come true for me.
It's just been so rewarding to hear about the journey of this incredible patient who not only has done well clinically and has responded to the treatment pathway that I started her on, but also that she's become such an incredible advocate for this area that has been able to benefit from her voice.
If you've had cancer, you still can have a life.